Portfolio Committee on Health is holding public consultations on the Tobacco Products and Electronic Delivery Systems Control Bill. Now, the hearings are taking place as a new tobacco interference index reveals that South Africa is among countries in which government interference is going up. Now, for the latest on these developments, I'm joined by Lorraine Govender, who's National Manager for Health Promotion at the Cancer Association of South Africa, who is actually at the Gauteng hearings in Heidelberg. A very good afternoon to you, Lorraine. Thank you so much for your time. In the face of the ongoing tobacco contestation, what's coming out of the hearings that you're attending?
So today was quite an eye-opener. We saw a lot of industry presence, a lot of people, community members wearing the regalia from the tobacco industry. And surprisingly, when we asked them what they were there for, they didn't really understand the purpose and why they were there. So it's almost as if they were pulled off the street and promised a T-shirt and a meal to come into the hearings. So they are here out in their numbers, but we are not intimidated by that. We are here to save lives, and that's what the tobacco legislation is all about. So it is quite intense. I'm from KwaZulu-Natal and experiencing something quite different here at the Lesedi Community Hall during the tobacco control hearings.
You say it was intense. Are you talking about the level of tensions that were experienced during those talks?
Yes, it is. So, what the industry is pushing the narrative, and then I'm sure you also know about that narrative, loss of jobs.
Yeah.
So one of the community members said to me, he was there because he's worried about jobs. And I said to him, well, I am here to help save lives. And what is a job if you are affected by cancer or other NCD diseases? It debilitates you and you can't even work. So a job is meaningless to you in that instant. So, there's a lot of misconceptions. People don't understand that the bill is here to protect the people. That is what it's all about. That is why I say it is quite tense in terms of what people are saying. It's the same things, lots of jobs. They talk about illicit trading and, the fact that it's going to affect the economy, the tax. Now, we all know that it costs the government 42 billion to treat tobacco-related illnesses, and the tax that we get back in terms of the sin tax is 12 million. So if you look at that, it far outweighs the monetary value. But, our community, unfortunately, they don't know enough. They haven't been well informed in terms of the health impact, because it's not just about losing your job. When you have some of these non-communicable diseases like cancer, you lose your job. You lose your life, and if you do survive, your quality of life is also compromised as a result of using tobacco products. So, it's sad that we don't know enough, and what the industry is pushing, that narrative seems to be more pronounced in terms of what they are listening to.
Yeah, because essentially, what you're saying is that the bottom line for tobacco companies is profits coming at the expense of human lives. As you try and get a sense of the bill and how it'll protect people, what stands out for you in terms of those aims and parts that will be protective of those who need to know about their rights when it comes to tobacco?
Yeah, if I look at it, the first one that really stands out for me is the 100% public smoke-free places and certain indoor places as well. So we get a lot of complaints from community members, like members living in an old age home who are exposed to secondhand smoke, and they don't have a voice. They fear intimidation. They fear loss of their accommodation if they come out and stand and say, you're not allowed to smoke. So we believe that through the awareness around the tobacco legislation, people will become more aware of the dangers dangers of it and not compromise people through the exposure of secondhand smoke. So we believe strongly that legislation is out there to protect people. If you don't have legislation, you don't have commitment, and you can't take people up on in terms of the consequences of not complying to anything. So that's the first part of it. The second that really stands out for me is the control of e-cigarettes and vapes. So currently that's not regulated under the tobacco bill. It came in as a quit smoking aid. It should have been given under prescription. And we find that people that have switched to vapes and e-cigarettes with the hope of quitting are actually, saying to us their health is compromised. They don't feel well when they are inhaling this. And if you look at the surveys and the research that's been conducted in our country, and you look at the age group, 15 to 24, high prevalence of vapes. Now, these are definitely not people that are trying to quit smoking.
Yeah.
We are having a new generation of people that are starting to use nicotine. And if they can't get these devices, which is quite expensive, they're now switching over to normal cigarettes. So we're having dual users. We're having a new generation of people that are becoming addicted to tobacco use.
So the index release speaks to a new report which shows that governments failed to adequately guard against interference from the tobacco industry in policy making. How imperative will it be for the changes to occur through this bill?
So all we're asking is for the Ministry of Health to take, well, it's not only the Ministry of Health, we're asking for all government departments to take note of what is really going on in this country. And, and sorry to say this over television and live, I was standing in queues today trying to get in. And it is so strange how the industry members came in and they were just allowed in some of the cases. While I was standing there trying to save lives, the process is not fair. I want to say that. So what the index report showed is there's multiple corporate social responsibility activities that involves the tobacco industries, and this was recorded, and it included non-health related activities such as support for veterinary vaccination, stock theft, prevention of environmental conservation. The TI also partnered with non-governmental organizations that worked with government. These activities included food programs, sponsorship for academic scholarships, monetary contributions for research and events. The funds for events and research were later turned to the TI industry by respective agencies following objections from civil society. So it was eventually turned down. But what we want to say is whenever there is a situation, the industry is the first to try and offer support and money. It's simply because they want to show that they have a presence and they want to see, that they are involved in corporate social responsibility. But if you think of what they are producing, if you look at it, tobacco products are responsible for over 16 different types of cancers, not only lung cancer. And we're seeing younger people, last month we had a soccer player who died from lung cancer. I'm not sure if it was tobacco related. But we're finding younger people that are affected by it as well. And we find, working at the Cancer Association, we see the disease. We see the people that are coming in with thoracotomies. They don't have a voice box. They've lost their tongue because of oral cancer and tobacco use. They need to have transplants. And we look at the amounts of money that government needs to invest in this. It is a concern. So the industry definitely, is delaying the tactics, and we saw that today in the numbers that came forth. And there's also unnecessary interaction. The TI interacted with government officials in corporate social responsibility events through its front groups. Now you see that. You see influencers that are on social media that are pushing, if you look at the vapes and the e-cigarettes, you see it all over, and our youth look up to the influencers. They look up to media, and having this coming through is just not fair. Yeah. So there is no government policy that requires the disclosure of meetings or interactions with the tobacco industry. The government indirectly accepts assistance from the TI through involvement with these front groups. And also this is definitely a conflict of interest.
Yeah, with no control on the e-cigarettes and the vapes and the growing trends, making it look fashionable when it really will compromise one's health, what additions do you want to see around that space being added to the bill?
So if you look at it, in the current space that we are in, with the current legislation, tobacco we're not allowed to see tobacco advertising in movies, banners and out there. There shouldn't be any tobacco advertising. But because e-cigarettes and vapes is not controlled under the tobacco legislation, and it will be controlled in the new legislation, that advertising will stop. Because that is what people, if you look at where are the vape shops, it's situated near the tertiary institutions. So our youth are targeted by the beautiful advertising around it. They think it's a trend, the beautiful flavors, it smells nice. And when we talk to our youth about why they're using it, that is the reason why they use it. So, it's trendy, it's cool, and I want to fit in with people, and the fact that it's not regulated, parents also think it's safe for the children to use vapes and e-cigarettes as opposed to normal cigarettes. However, it is dangerous because it has nicotine in it,
Yeah, absolutely. Thank you so much for bringing us up to speed.